Hello, good day, grade 10, and welcome to another discussion on the components of MAPEH, specifically on the health. So let's start our discussion. So let's have a quick recap first on the second quarter, and I want you to prepare your paper and pen with you, and we need to assess whether you still remember the different health related laws and their importance to the society and its citizen and choose the letter of the correct answer based on the given statement. So I hope that everybody is ready for today's lesson. Number one, it supervises the legal production of cigarettes in the country. Is it A, Consumer Act? Letter B, Tobacco Regulation Act? Letter C, Anti-Hazing Law? Or letter D, Seat Belt Use Act? Number two, provide assistance for the prevention and control of AIDS. A. Anti-Hazing Pornography Act. B. Cybercrime Prevention Act. Letter C. Philippine AIDS Prevention and Control Act. Or letter D. National Blood Services Act. Number three, it provides for the regulations of products, services sold and offered in the country. Is it A. Consumer Act? B. Tobacco Regulation Act? Letter C. National Blood Services Act? Or letter D. Seat Belt Use Act? Number four, it penalizes vehicle drivers who are under the influence of drugs and alcohol. A. Anti-hazing law. B. Anti-drunk and drug driving law. C. Anti-child pornography act. Or letter D. Tobacco Regulation Act. Number five, it describes the blood donation program in the country. Is it A. Anti-child pornography act? Letter B. Consumer Act? Letter C. National Blood Services Act? Or letter D. Anti-hazing law? Okay, let's check your work. For number one, the correct answer is letter B. Tobacco Regulation Act. Number two, it's Philippine AIDS Prevention and Control Act. It's letter C. Number three, it's letter A. Consumer Act. Number four, it's letter B. Anti-drunk and drug driving law. And lastly, for number five, it is the National Blood Services Act. So count the number of check. So for those students who got 4 to 5, you still remember our previous topic of the second quarter. While for those students who got 3 to 2 and 1, you need to review what are the different questions that you think you answer it in the wrong way. Let's continue. So for today, we're going to discuss now the different global initiatives which improve the world health. So just like on the second quarter, it more focuses on the Philippines, which is addressing the different issues and concerns pertaining on our country. But for today, we are more taking on the another level and which refers now on the world health. So the target mark is whoever discusses the different significance of global health initiatives or what we call the GHI. So I want you to have this kind of activity that what we call the word hunt. You need to look for 10 global health issues and concerns that the World Health Organizations and the member nations are facing. You can use your class point in answering this one, or you can copy the given template and locate the 10 words. Here's the template. Let us say that you already find the different related laws which pertains, on the 10 global health issues and concerns. So here are the answers. We have malaria, water safety, health, mental health, DOH, HIV, AIDS, environment, nutrition, drugs, and tobacco. So again, for those students who locate 8 to 10 words, congratulations. For those students to 5 to 7, good job. And then for those students who get 4 and below, you keep on looking those different kinds of words. Moving on, I want you to answer the given guided questions. And I want you to take down on a sheet of a paper and write down some information that you think that as you as a student can share the global health initiatives. Number one, what are the current health issues and concerns in your community? Share and discuss these health initiatives. Number two question, what will the world be like if health issues and concerns are not properly addressed by peoples around the world? Number three, if you are a health worker in your community, what health issues and concerns do you think should be addressed immediately? And you need to explain why. All right, let's move on now to another activity or what we call the brainstorming. So I'm going to read the directions. Brainstorm on this. What are the biggest health issues and concerns that people around the world face today? You need to list down on your paper. You can ask your siblings, your mother, your father, and other family members to share their ideas regarding on the health issues and concerns which are the world facing off. Don't forget to send it this one to your teacher. So let's move on. So for today, we're going to discuss now the global health, Millennium Development Goals, and the global health initiatives. So let's define first what is the meaning of the global health. The term global health rose in the popularity along with the rise of the globalization. Both terms improve the public awareness of vulnerabilities and shared responsibilities among the people for the different injustices in the world. Global health initiatives is defined as humanitarian initiatives that raise and disburse additional funds for infectious diseases such as the HIV or the AIDS, the tuberculosis and malaria for immunization, and for strengthening the health system in the developing countries just like the Philippines. The GHIs or the Global Health Initiatives classify a type of global initiative which is defined as the organized effort integrating the involvement of the different organizations, whether it's individuals and stakeholders around the world to address the global issues such as the climate change, the human rights, the environmental sanitations, and others. So they propose a target goals and they call it the Millennium Development Goals. It is a words time bound and quantified targets for addressing the extreme poverty and its many angles. So the MDGs targets the different kinds of situations and concerns that they think that the words are facing off, which they targeted on the year 2015. I repeat, the MDGs targeted this one on the year 2015, and somehow you need to assess whether on the year 2015, uh, have they already targeted what happened on the next years? What are the programs that being established? So for number one, they have here the eradicate extreme poverty and hunger. They achieve universal primary education. The MDGs target to promote gender equality and empower women. Another, the MDG target reduce child mortality, improve maternal health, combat HIV or AIDS, malaria, and other diseases, ensure environmental sustainability, and a global partnership for development. So let's discuss it one by one. So MDG target number one, eradicate extreme poverty and hunger. And we all know that developing countries, particularly in Africa and Asia, suffer from extreme poverty and hunger. And we all know that the poverty and hunger leads to the several um, malnutrition, which leads to the lifelong physical and cognitive learning, which is learning and reasoning damage, and affects our health, well-being at the same time our economy. So what are the ways forward to target this one? Of course, we have your education. It's being said that MDGs, you need to promote education for all, promoting gender equality, producing more jobs to sustain and to eradicate the poverty and hunger, investing more in agriculture, strengthen the nutrition programs for children and infants, and lastly, support and protection of developing and vulnerable countries during crisis. You need to assess, have the MDGs already targeted this one? They have they eradicate the poverty and hunger in our country? Number two, MDG target achieve universal primary education, in which persons, particularly women who are educated, are more likely to seek medical care, especially during pregnancy, ensuring proper nutrition for their family, adopting healthy sanitary practices, and ensuring immunization of children. As in effects, infants and children have better survival rates, are healthier, and better nourished if these are attained. Children are, of course, it's been said, they marry and have their own families at later stage in life, practice family planning and have fewer children, know rights, responsibilities, and civic obligations, seek employment and sustain personal and family needs, have decreased risk of getting sexually transmitted infections such as HIV or AIDS, and lastly, support and protection of developing the vulnerable countries during crisis. Number three, MDG target promote gender equality and empower women. Gender equality means equal representation of men and women. It implies that all genders should have equal value and treatment. Equal gender treatment empowers women and other groups, creating opportunities in education, work finances, and other aspects, which improves the economy and lessen effects of financial crisis. Do you think here on the Philippines they already target the gender equality and they already empower the women? The MDG ways forwards are the following: early childhood development intervention, promotion of women's political rights and involvement, improve reproductive health programs and policies, education and integrating gender equality in the school curriculum, improve women's access to work and strengthen labor policies for women, and support and protection of developing vulnerable countries during the crisis. Next target of the MDGs, we have your reduce child mortality. Programs and policies which help reduce child mortality, like improving nutritional intake, healthcare facilities and infrastructures, and other fields, which improve children's lives. So they say that strengthening the local and the national health programs and policies is one way to reduce child's mortality. And here are the steps in order to attain the MDG's target to reduce mortality, child's mortality. We have immunization programs for all children, assuring the survival and better health of mothers, improving reproductive health programs and policies, and better nutrition program for infants, children, and mothers. Next MDG target is we have here to improve maternal health. Improve maternal health is not only about the mother's health but also involves the health and wellness of the family. Maternal health also helps eradicate other problems like poverty, gender equality, decreased workforce, lower birth rates, and disability of the women. And here are the different ways forward of the MDG. Improve and proper nutrition of the mothers. Teaching the benefits of birth, spacing, and small family size. Educating young boys and girls about the importance of maternal health and better improve access to hospitals care, especially obstetrics, gynecology, prenatal, and postnatal care. Do you think the Philippines already improved the maternal health care here? Moving on, for the number six is to emerging and re-emerging diseases like the HIV and AIDS, which are the malaria, influenza, and other diseases affects which the productivity and the growth of the nations. Some of the effects of the diseases outbreak are loss of the jobs, shortage in the professional workers, and creating social crisis. And here are the different steps in that the MDGs ways to break this one is we have to improve housing conditions, increase access to anti-malaria medicines, promoting safer sex behavior and preventive education for all, promoting TB screening of HIV or AIDS persons, and PV directory observed treatment short course therapy, and lastly, promoting the use of insecticide-treated nets to fight mosquito-borne diseases. Number seven target of the MDG on the year 2015 is to ensure environmental sustainability. investing and supporting sustainable energy like solar and wind and water energy, which helps support jobs and create business opportunities and save remaining non-renewable energy resources. At the same time, environmental sustainability assures people to live healthier and enjoy a clean, green environment. And to lessen this one, they need to improve the cleaner air and environment, clean, environmental friendly, and renewable energy, new and aspiring jobs and business in energy, and increased access to sanitation. And last but not the least, the MDG goals is to a global partnership for the development. The UN or the United Nations, the World Health Organizations, the World Bank, and the government works together hand in hand in which to make sure there is a fair trade and that the heavily indebted countries obtain relief and funds to combat poverty, malnutrition, and funds for education and social projects. MDG ways forwards are the following. They need to expand international trade agreements. They need to improve access to affordable medicines, reduce poverty through government debt relief grant, and develop information and communication technology or what we call the ICT infrastructure. So the MDGs on the year 2015, that's the MDG target already. That's one of the different targets. Is it improving or not? So the year 2015, they call it the MDGs. But the year 2030, they target and name it Sustainable Developments. So as you can observe on the MDGs, they have 8. While here on the Sustainable Development Goals, we have year 17. Do you think on the year 2030, some of the different goals already developed, improved, or still on the bottom? Here is the closer look on the Sustainable Development Goals. Number 1, no poverty. Number 2, zero hunger. Number 3, blood health and well-being. 4, quality education. 5, gender equality. 6, clean water and sanitation. 7, affordable and clean energy. 8, decent work and economic growth. Number 9, industry, innovation and infrastructure. Number 10, reduce inequalities. 11, sustainable cities and communities. 12, responsible consumption and production. 13, climate action. 14, life below water. 15, life on land. 16, peace, justice, and strong institution. And lastly, number 17 is partnership for the goals. So I want you to assess what if. We need to predict whether the MDGs, whether they achieve or not the given situations. Here's the template. So you need to copy and to fill out the information. What if the MDG goals achieved? And the next column, what if the MDG is not achieved? What will happen? Buzz time. So if you have any questions, feel free to chat with your teacher. Let's start. So I want you to have answer the matching type in which you need to match the column A with the column B and identifying the MDG goals. Use your class point. If you don't have, just copy the given format and do this one in your paper. Number 1, reduce cell mortality. Number 2, ensure environmental sustainability. Number 3, improve maternal health. Number 4, global partnership for development. And number 5, promote gender equality and empower. So if you got 4 and 5, congratulations. You fully understand our lesson for today. And if not, 3, 2, 1, you need to review the following questions and concepts in order for you to clarify. So I want you to jot down in your in paper or in your notebook the following reflection. Number 1, in this lesson, I learned that. Number 2, in this lesson, I discovered that. For number 3, in this lesson helps me to develop my skills in block. And to end my discussion for today, I want you to memorize and take down on this quote and ponder: a dream becomes a goal when action is taken towards its achievement. Thank you very much and see you in our next topic. Have a good day.